Are annual flu vaccines truly effective? Imagine a tool that helps protect millions from a serious illness each year. That tool is the flu vaccine. But how well does it really work? The truth is, flu vaccines are generally effective, but their success can change from year to year. This variation depends on how well the vaccine matches the flu viruses circulating that season, how soon you get vaccinated, and your personal health. Major health organizations like the Centers for Disease Control and World Health Organization agree that getting vaccinated every year is the best way to lower your chances of catching the flu, ending up in the hospital, or even dying from it. The effectiveness of the flu vaccine can differ depending on the season and who you are. For the 2020-05 flu season, estimates from the CDC suggest that the vaccine prevented about 32 to 60% of flu cases in outpatient settings. It was even more effective at preventing serious illness that leads to hospitalization, especially in children and teenagers, where it ranged from 63 to 78%. In adults, the protection was a bit lower, around 36 to 55%. Younger people tend to benefit more, while older adults may see slightly less protection because of age-related immune system changes. Every year, scientists and health authorities work hard to predict which flu strains will be most common. They select the strains to include in the vaccine based on global surveillance data. The vaccine usually contains 2 types of influenza viruses and 1 influenza B virus. This careful process aims to match the vaccine as closely as possible to the viruses that will circulate. When the match is good, the vaccine works better. If not, its effectiveness can decrease. Timing also matters. The vaccine takes about 2 weeks after injection to provide full protection. Because immunity can fade over time, experts recommend getting vaccinated in early fall, around September or October. This timing helps ensure you are protected during the peak of flu season, which often runs from late fall to early spring. But personal risk factors, such as age or underlying health conditions, may influence when you should get vaccinated. Some recent studies have stirred discussion. For example, a preliminary report from Cleveland Clinic suggested the vaccine might have had a negative effectiveness of nearly 27% for the 2020-05 season. This means vaccinated people appeared to have a higher rate of flu. However, this study has not been peer-reviewed and has potential limitations. Broader evidence from multiple sources still supports vaccination as a key tool in flu prevention. Even when the vaccine does not completely prevent infection, it can still reduce how severe the illness becomes. Vaccinated people are less likely to end up in the hospital or experience serious complications. During the 2020-05 season, despite a tough flu year with many hospitalizations and deaths, vaccination played a vital role in reducing the overall impact of the flu. Remember, vaccination is just one part of staying healthy during flu season. Good hygiene practices like washing hands often, avoiding close contact with sick people, and staying home when you're sick are important too. Combining these measures with vaccination gives you the best chance to stay healthy. In summary, annual flu vaccines are a valuable public health tool. They help reduce the number of people who get sick, go to the hospital, or die from the flu. While their effectiveness can vary, they remain as the most effective way we have to fight influenza each year. Experts continue to monitor and improve vaccine formulations based on the latest science. If you're considering vaccination, talk to your healthcare provider to determine the best timing and approach for you. Staying informed and protected is the best way to face flu season confidently.